Welcome to our panel on behavioral health and rail safety. Behavioral crisis is out there, and that's part of the reason why our DRSC chose our present title, public.health.crisis. Hilary Konczal, gosh, you've been a friend of ours for many years. You've been doing Metra safety work for over 30 years, I believe. Hilary's the Chief Safety and Environmental Officer for our partner, Metra. Hilary's responsible for Metra's overall safety performance, including trespasser safety initiatives and programs, which we're discussing today. So Hilary, it's all yours, buddy. Thanks.
Thank you, Lanny. I just want to thank the DuPage Rail Safety Council to allow me to present or moderate an important panel such as this, a behavioral crisis, behavioral health and rail safety. As Steve Laffey and Administrator Jennifer Mitchell discussed, trespasser incidents continue to rise, and they're on, throughout Chicagoland. Cook County is the highest, one of the highest counties within the nation, with the greatest number of trespasser incidents, many of which are suicides. For us at Metra, 47% of our fatalities are considered confirmed suicides or suspected suicides. Metra began addressing trespassers who died by suicide since 2017, where we implemented suicide awareness training to our employees, such as our engineers, train crews, and all forward-facing employees. This training gives our employees the tools to identify someone in distress and safely intervene and bring them to safety. Over the past years, there's been a lot of progress in research and prevention into trespassers who die by suicide. However, there's much more work to do. With that, I'd like to introduce our first presenter, Jeff Warner. He is a TTI Associate Research Analyst with Texas A&M. Transportation Institute, where he served over 25 years. Well, he has over 25 years of experience working on a variety of highway, rail, grade crossing, trespasser, freight, and passenger railroad and general freight related projects. He's a member of the Transportation Research Board Highway Rail Crossing Committee and chair of the Joint Subcommittee on Railroad Trespass and Suicide Prevention. He received his Bachelor of Science and Master of Engineering degrees in Civil Engineering from Texas A&M University. With that, I'd like to turn it over to Jeff Warner.
Great, thank you so much, Hilary. And I appreciate the opportunity today to talk about our recently released report that focused on strategies for deterring trespassing on rail transit and commuter rail rights of way. Broken up the presentation into three parts. The first is a general overview of the project activities. The second goes into more details from the case study findings. And finally, I'll share the countermeasure strategies and the selection guidance developed as part of the project. The project objective was to provide guidance on strategies to deter trespassing on rail transit and commuter rail rights of way in exclusive and semi-exclusive rights of way, including within station areas outside designated pedestrian crossings. I had previously worked on TCRP Report 175 that focused on the designated pedestrian crossing locations. This project expands that to include the areas outside the crossings and along the rail rights of way. This project and others within the Transportation Research Board Cooperative Research Program often follow an approach that starts with the literature review, goes more in depth with surveys and case studies, and then synthesizes everything into final project products. The main objective of the literature review and current practices task were to capture the strategies to deter trespassing and document current applications of these strategies. We submitted a spreadsheet containing 121 reviewed resources to the panel. With continued collection of resources after that time, we probably approached 150 resources reviewed. The survey presented our preliminary list of strategies to practitioners to understand utilization by the agencies and to have the agencies identify any additional strategies. The survey was also used to assist with selecting possible case study locations. For the survey, we had 41 unique entities that completed the survey. There was a good level of completion by both the U.S. agencies and international community. 27 U.S. rail transit commuter rail agencies completed the survey. These agencies represented 59% of the agencies with light rail, 59% of the agencies with commuter rail, and 64% of the agencies with heavy rail. The original plan was for 4 on-site case study visits with U.S. agencies and 1 virtual case study with 1 non-North American agency. Of course, COVID-19 impeded our ability for in-field trips, so we had to adjust. So we expanded the case studies to 5 U.S. and 2 international agencies, along with several other interviews with additional agencies, which I labeled as secondary case studies. Our requirement for virtual case studies resulted in multiple virtual meetings per agency, which really extended the case study task period. However, one benefit of the virtual case studies was the ability to expand the pool of people involved in setting up additional meetings that were more refined and focused. So perhaps 1 meeting with operations, 1 meeting with maintenance, etc. The secondary case studies were an opportunity to contact several stakeholders to help fill in some gaps of understanding we had and to discuss specific topics. For example, SEPTA in Philadelphia and surrounding areas provided a great overview of the collaborations they've undertaken to address suicides on their rail transit systems. So the 5 U.S. studies that we performed, case studies, were MTA in Baltimore, Metro North Commuter Rail in New York, Utah Transit, Salt Lake City, DART in Dallas, LA Metro in Los Angeles. With these case studies that allowed us to examine 4 light rail, 2 heavy rail, and 4 commuter rail systems. And then the 2 non-North American case studies were ProRail in the Netherlands and the London Underground in the UK. Just a few quick general observations from the case studies. These are, of course, much more detailed in the final report. So there were several countermeasures that we had not seen within the literature or survey responses. In the case studies, the conversations we often heard, you probably aren't interested in this, but we use this for X. And we would all say, what? That's great. So we would write that down. Technology applications were discussed with each agency. We heard from most that false positives are a major hindrance in usage, including several who had removed applications to do this issue. False positives unnecessarily pull critical resources and reduce confidence in the technology. They can also cause agencies to slow or stop trains unnecessarily. The agencies really seem to reflect a change in thinking about suicides from nothing they can do to looking at ways to intercept people in distress. This includes significant efforts training employees to recognize suicidal behaviors and introducing positive ways to interact with the traveling public. I'll briefly go into more detail about a couple of the agency efforts to deter activities aimed at self-harm. Utah Transit has light rail and commuter rail operations. They seem to have a bigger suicide issue along the commuter rail systems in the rural areas. One approach to this problem was the installation of what they called hope poles. These poles have motion-activated lights and suicide prevention signs. They're placed along the right-of-way a few feet away from the grade crossings. Utah Transit indicated to us seeing a video of a person walking up to the pole, basically hugging the pole for a few moments and then walking back to the grade crossing and away from the track, which could reflect a life saved that day. Also on the side of this poster is a suicide prevention campaign poster. Sorry about that. In addition to Utah, several other agencies were actively participating in suicide prevention campaigns and efforts. This slide just shows a few examples, including Metro North hosting a community walk, Los Angeles placing suicide prevention signs near crossings and stations, and ProRail in the Netherlands with signs with the message, "I'm listening." At the time of our case study discussion with the London Underground, London had initiated a citywide mental health initiative called Thrive London. It seemed to me during the discussions that the London Underground did not like suicide-specific messaging in the stations. They didn't want to draw attention to the rail as a possible vehicle for suicide. So the broader mental health campaign was seen as a good fit for their goals. This slide shows a couple of the Thrive London posters utilized around the city and in the stations. On the right was another intriguing strategy where they had messages on the service information boards. They began writing supportive messages on the boards and started broadcasting through an Instagram at all on the board. In case you can't see, the board on the right says, "Don't delete yourself." I believe they won several awards for this. Most of the agencies indicated increased efforts to collect and analyze data to support a better understanding of trespassing issues on their system. Amtrak used advanced data analytics to identify the best locations for placement of suicide prevention signs. In one presentation, they showed as a result of placing these signs that they experienced an 81% reduction in suicides after 3 years of installing suicide prevention signs in California. It's very impressive. All right, this section will cover our guidebook specific content. So in synthesizing the information for the guidebook, we ultimately combined all the strategies into 14 countermeasures grouped into 3 categories: engineering and physical measures, education and engagement, and enforcement. This page shows the 8 engineering and physical measure strategies. And then here we see the 5 education and engagement and enforcement strategies. We spent a lot of time reviewing other guidebooks and going back and forth internally to come up with the best ways to convey the guidance on how to select appropriate countermeasures based on the given situations. The goal was for us to narrow the option for agencies to consider, not dictate the solution. We ended up developing 3 ways to view the select possible countermeasure strategies. The first is by ease of implementation. We wanted to show that some strategies were more achievable quickly and more cost-effective than others. We did this by dividing the countermeasure strategies into 4 tiers, generally from easiest to implement to those that are more complex to implement. For example, adding signs is likely easier to implement than fencing. The second way is by summarizing important aspects of each countermeasure into a static table that can be reviewed as needed. For each countermeasure, we have the rail system type, problem location, range of cost, types of trespassing addressed, root cause, ease of implementation, and benefit cost trade-offs. All this information is further described within the guidebook itself. Finally, we developed an interactive spreadsheet that allows users to select options based on the situation they are attempting to address. Within the guidebook, we came up with 3 scenarios to demonstrate situations that agencies could be facing and how they could narrow the countermeasure strategies. This shot displays the selection for scenario A, which indicates the trespassing problem is on a commuter rail right-of-way with root cause of shortcut route convenience. These selections, with all the ease of implementation options maintained, narrows the countermeasure options to 10 countermeasures. The spreadsheet has tabs with guidance of each countermeasure that corresponds with that's included in the guidebook. So by selecting the countermeasures of interest, the user will be transported to the information tab. The final project products were released this summer on the TRB website as TCRP Research Report 233. Volume 1 guidebook page includes links to download the interactive spreadsheet and to view a summary video. The video turned out good, so I encourage you to look at it when you have a chance. The Volume 2 research overview contains all the nuts and bolts of the research effort, including the detailed case study findings. That concludes what I have for you today. Thank you so much.
Okay, thanks, Jeff. That was excellent research, a lot of good data. I appreciate it. And you know, the work that you guys do at the Transportation Research Board is extremely important, because without that work, a lot of the research wouldn't, you know, the knowledge base and the research wouldn't get out to other agencies and the public. So thank you for that. Our next presenter is Scott Gabree. Scott is a very good friend of mine, but he's an engineering psychologist with Volpe, with the Volpe Center. Scott is the manager of the Trespass and Suicide Prevention Grade Crossing Safety Research Program of the Human Factors Division at Volpe, the National Transportation System Center. He and his team work closely with the FRA to conduct research to close knowledge gaps and identify emerging strategies to reduce fatalities on the nation's railroad system. And just like Jeff, he's got a lot of research. He's done a lot of research on suicides and trespasser incidents. So with that, I will turn it over to Scott.
Thank you, Hilary. Appreciate it. Thank you, Lanny and the DuPage Railroad Safety Council. It's always a pleasure to come talk with you folks and hear all the great people that you bring in to talk about this important topic. Today, I'm going to be talking about trespassing and suicide prevention through education, really recognizing that this is work that was done by my colleagues and I, Stephanie Chase, Danielle Holtunen, Alexa Diadamo here at Volpe, and all really done for FRA, Dr. Shayla Blue being the main sponsor of this. I also realized earlier today, and as Deputy Administrator Mitchell was giving her remarks, a lot of what I'm going to talk about is just going to dig a little bit deeper into what she already kind of highlighted today. So hopefully you'll see that through line. Clearly, trespass and suicide are driven by a tremendous number of different factors, many of which are outside the railroad's control. And starting to piece together an understanding of what the motivation is of these individuals to be on the tracks is critical for prevention. As I think Jeff just highlighted, there's a lot of different strategies, and often a multifaceted strategy is what's needed, not just engineering or just enforcement, just education or data analysis or collaboration, but some combination of all of those. But with education being kind of one key component and one key part of that strategy. Next slide, please. When I say education, I use it in a very loose term. I think what we're doing today is education, and what the DuPage Railroad Safety Council and folks do on a regular basis is to educate people about what they can be doing. Today, I'll talk about some different ways that we think about education, and FRA thinks about education, which is to consider both trespassing and suicide with rail safety education, talk a little bit about our work with Operation Lifesaver, coordinating with the international community through GRASP, the Global Railway Alliance for Suicide Prevention, collaborating with peers, which this is, I think, a part of that. I'll talk a little bit more about suicide prevention in US Rail, our newer working group. And lastly, about the toolkit that the FRA just launched as a way of kind of educating anyone who wants to know more about this, about knowledge and best practices for industry stakeholders. So to start off with our relationship with Operation Lifesaver, FRA through Volpe has had a relationship with Operation Lifesaver for a long time. We helped them to develop the guide that you can't see because it's too small on the screen, but which is a resource for safe and effective messaging for rail incidents, talking to the public about it. We've also, especially in these past couple of years, provided some subject matter expertise related to how to think about suicide prevention when messaging about trespass safety. And that's been a part of something that we've done over the past couple of years. On the next slide, I'll talk a bit about what that means. And a lot of that is things like de-emphasizing lethality, de-emphasizing how quick a death might be were a train to strike somebody, whenever possible, focusing on the behaviors that you're looking for, empowering someone to make good choices rather than slapping the wrist for making bad choices. The lethality and quick death part of it is something that I think used to be a big part of railroad safety messaging, but I think over time we've learned that we can be more effective, reach more people in an effective way by maybe de-emphasizing that and just talking about rail safety in a slightly different way. Next, a different type of education is educating ourselves, learning from what others have done. Back in 2014, we formed the Global Railway Alliance for Suicide Prevention, we not being Volpe, but Volpe along with FRA and the Association of American Railroads, coming together to see what we could learn from our international colleagues who have done a tremendous amount to advance knowledge in this area. Next slide, please. To date, I think we have participation from over 10 countries. We have a meeting again later this year that I think we have a couple new countries that are joining, Croatia and there's another one, but I forget exactly who it is, but a lot of different perspectives providing a lot of incredible insight. I know that we have taken this information and brought it back. I know Hilary and I have had a lot of conversations about what comes out of these meetings, things like the QPR and employee training. Those are things that have been happening in the UK and other countries throughout Europe in ProRail for a number of years. And I think we've learned from them about how we can take that knowledge, not necessarily translate it directly to the US, but understand there might be cultural differences, but adapt it to be effective here in the US. So something that we look forward to continuing as we go forward. There was a lot of interest in joining GRASP from other US representatives, and we realized that if we continue to add more US representation to GRASP, it would become a US meeting rather than what it's intended to be, which is kind of countries to share different perspectives. So last year, FRA created a working group called Suicide Prevention for US Rail, the SPUR working group, which is exclusively focused on commuter rail carriers for the time being, to provide a space where commuter rail carriers can talk directly to one another about what they've got going on, what they're doing, where they're struggling, with the idea of highlighting a way to try to prevent trespass or suicide and have an open forum for them to talk to one another about it. We've been meeting, as I said, it started last year, so only a handful of meetings at this point, but trying to meet roughly quarterly to provide that opportunity to speak. We've had topics, we talked about QPR. Hilary gave a fantastic presentation that I know a lot of people that were on that are looking to do these QPR type employee training programs, I think got a lot out of the experience that Metra had in implementing that. And I think we'll be taking that back to their own railroads. We had one recently about effective partnerships with outside groups, with folks like the Crisis Text Line or the Suicide Prevention Lifeline, or local trespass and suicide prevention groups. Hoping in the future to have meetings about advanced technologies, about employee and crew care after incidents. I think a lot of topics that bubble up to the top as issues that these groups may be able to talk to one another about. As I said, right now, if you're a commuter rail carrier and are interested in participating, please reach out to me. I'd be happy to connect you. We're hoping as this goes forward that we can increase participation, because I know there's a lot of folks that would provide a lot of great information to this group. So if membership opens up a little more, we'll be sure to reach out to folks as well. Next slide, please. So the last thing I want to talk about is the Trespass and Suicide Prevention Toolkit that the FRA launched earlier this year. You can see the link down at the bottom. There's I think a QR code later. The idea here was the FRA realized that they have, I think it was born out of both, that there was groups in Europe, Restrail, a group that had developed a similar toolkit that was incredibly useful, but really tailored towards the European experience. And also FRA realizing that they have a lot of really great resources, but often they might be buried in technical reports that it might take someone a little while to get to, or someone might be maybe intimidated by the length of a report. So if we could develop a way for rail carriers or other parties that are interested in doing something about trespass, suicide prevention, that they could come here, digest easily what kind of work is being done, and then ideally link to more detailed reports if they wanted more information. Consider safety improvements, help identify partners and how to form those partners, and stay up to date with research. Next slide, please. We have things called measures. We call them measures, but for this one, anti-trespass panels, which are like those pyramid cones that are difficult to walk on. As an example here, for each one of these measures, there are 7 different tabs: a description, some notable practices, for trespass panel, anti-trespass panels, things like if you live in a place like Chicago or Boston, where I am, that snows a lot, sometimes they can fill up with snow and you need to maintain them over time. Some advantages, some drawbacks, some images, references, related measures being other measures that might be there. The references, you'll see in each of these, there are links to those places. So if somebody wants to find out a little more, they can go to it. Next slide, please. Just to talk a little bit more, since I was talking about education today, there's one part that you can kind of filter the content on the website is through intervention strategy, which we have kind of 4 high-level areas: data to understand the problem, different engineering solutions, education, and enforcement. Education is broken down into two kind of sub areas. So next slide, I'll talk about the first one, which is really how to collaborate with partners. on the next slide, please. Perfect, thank you. So that's things like partnering with national organizations like the 988 Suicide and Crisis Lifeline, with local partners. Down at the bottom is the Samaritans, who the MBTA up here in Boston partnered with, or even partnering at a national level with a group like the National Action Alliance, who you might be able to understand a little bit more about from a national perspective, how these things are being addressed. On the next slide, it's beyond collaborating with partners, but also how do you educate either your staff or your ridership? So things like see something, say something as a way to ask riders to step up and do something. Like the QPR type of program, how do you educate your staff in order to identify people in need, or the one below, which is how do you encourage people to reach out to a friend or someone that they see that might be experiencing a mental health crisis. So next slide. So just to kind of update where things stand here, again, FRA launched this just earlier this year. So I think it's still kind of in the early stages, and two major things to highlight. The first is that the material will be updated. We have not even gotten to our first major update, so you'll probably see that there's some things missing. A few things in particular are trying to make sure that we're sending people over to the guidebook and the resources that Jeff Warner just talked about, because there's a lot of really tremendous stuff there that we're hoping, to make all these connections so that people can get to the places where all that good information is. So that first major update is forthcoming. The second being that we're seeking input from users. So if there's anybody that has thoughts about this, ways to make it more effective, things that are working, things that are not, especially, we'd love to hear from it. On the toolkit itself, you'll see a contact us button, and feel free to use that to reach out and offer suggestions or thoughts, because we certainly welcome them. And I believe that is it. So thank you so much. Appreciate your time today. Thank you.
Thank you, Scott. That's excellent information and research, obviously, but thanks for sharing the FRA toolkit a little bit more, expanding on it and discussing it. I think that's great information as well for a lot of people. I don't think that maybe they may have not known about it, but thank you for that. And then our third presenter, Lori Carnahan, she's the Director of Behavioral Health with the DuPage County Health Department. If you remember, the Deputy Administrator had mentioned that DuPage County is 44th in the nation as far as counties with the most suicides and trespasser incidents. So that it's great that we have Lori here with us. She's a wealth of interest and knowledge, and she's going to be talking on the 988, the new 988 number with the National Suicide Prevention Lifeline and other details. But Lori, like I said, she's a host of knowledge. She's a Director of Behavioral Health at the DuPage County Health Department and licensed clinical professional counselor. Lori has led the effort on implementing the National Suicide Prevention Lifeline, the 988, and many suicide prevention initiatives that focus on education, awareness, linkage, and quality treatment interventions to DuPage County residents. So with that, please welcome Lori. Thank you, Lori.
Good morning. Thank you so much. And thank you for the opportunity to be here today. I'm going to spend some time today. You can go ahead and go to the next slide. Really talking about a system as a whole of really how do we address suicide? How do we make sure that anybody that is in need has access to care? It's really to making sure that it's not one program, it's not one organization or one solution. It's really a set of structures and processes that are in place to really make sure that we can serve people effectively in DuPage County, but also across the state. So I'm going to spend my time this morning talking about the ideal behavioral health crisis system, what we have available in DuPage County and other areas across the state, and some more opportunities to continue to explore for a future system. So as we've heard this morning, the statistics are, we know the statistics, they're not good. We know that Suicide is a serious public health problem. We're seeing suicide rates, we see them kind of go up, we see them decline or stabilize a little bit, but we seem to have this ebb and flow, and we know that it's a continuing issue. We know that the pandemic really affected people in a different way, and that we're seeing an increase in mental health and substance use issues. We're seeing those issues kind of come to a head, and people really feeling like they're hitting their breaking point. And so, it really is, trying to deal with it in a different way, in a more systematic way, so that there's education out there, but there's access to care when people need that care right in that moment. So, if you look at, especially that, all of the bullet points are pretty staggering. And the last bullet point, an estimated 12.2 million American adults seriously thought about suicide in 2020. That's huge. 3.2 planned that, and then 1.2 attempted. And we know that, the rates of completed suicide are extremely high as well. So, as a public health entity and a behavioral health organization, what can we do as a community to make sure that we're providing that education and access to care as easy as possible for people? So to kind of give a little bit of a summary, the state and the nation, really nationwide efforts, are really looking to define this vision of crisis infrastructure. What do we need to do to make sure that that system is in place to be able to get every person every time? So the state, a couple of years back, has really kind of looked at nationwide best practices and has developed this crisis infrastructure vision and putting into pathways, really. So really having someone to call, someone to respond, and somewhere to go. So kind of connecting all of that, really making sure that that ideal system is every person receives the right service in the right place every time. So we talked a little bit, or we heard a little bit about the National Suicide Prevention Lifeline, and you saw some of the signs that have been posted and just that education out there. So 988 is formerly the National Suicide Prevention Lifeline. So the Lifeline had been available for many, many years. It is that 24/7 free and confidential support for those in distress looking for looking for resources on how to help a loved one. So really it was a 1-800 number that was designed just to be of that help in the moment. 988 has transitioned to that new number, launched on July 16th, 2022. And the goal of 988, which was also the goal of National Suicide Prevention Lifeline, is for those calls, if somebody's calling into that hotline, that they're routed to the nearest crisis center, the nearest local crisis center, for immediate intervention, for connection to local resources for help. Illinois has 6 centers across the state. So prior to the launch of 988 and prior to the initiatives kind of going on with 988, Illinois had actually a pretty low answer rate for actually getting to a local center. So you always got somebody, but really Illinois really realized we need to make sure that we're connecting to local resources. So with the transition and the launching of 988, Illinois has also identified a statewide center. So there is a statewide center for uncovered areas of the state. And then there's 5 other local centers that support certain areas. So DuPage County Health Department is one of the local center and serves majority of DuPage callers. So that vision of 988 is, why did they shift that? It's really to make sure that number is very easy to remember. Just like 911, you know what to do when you're having a medical emergency, when you need help right in that moment. That goal is to really make that the same process for when you're having a mental health or substance use emergency. So kind of dialing that, being able to dial that number to be able to get help in real time, and to connect that person to a trained mental health professional who can help with their immediate needs, really identify what they need in that moment, reduce some of those unnecessary 911 calls, trips to emergency departments, all of those types of things. And really to help end stigma So they know, you know what, this is very easy to reach out to. It's well known, it's easy to access. So really the hope for 988 is for that outreach to happen prior to that crisis level of care, where they're needing some level of that higher support, where you know, a 911 call or a transfer to a hospital. So kind of getting the word out about 988 and really making sure that everybody is fully aware of how to access that can really reduce some of those higher level crisis needs. So kind of in, you know, continuing on throughout the system, 988 hopefully, and is really in the process of collaborating with mobile crisis response teams. So kind of that someone to respond. So the thought is really, if you're looking, you know, from a systems perspective, if somebody calls into 988, they're talking with a mental health professional, and that mental health professional says, gosh, it really sounds like you need some immediate support, somebody to come to you to really talk further, to identify kind of what those needs are, to provide some of that crisis intervention, risk screening, determine that level of care, and then link to community resources for ongoing follow-up. So again, the state has really pushed mobile crisis response teams. Mobile crisis response teams is not new. It really is something that we in DuPage County, but across the state, have been doing for many years, but for really small populations. So what has happened in the state over the last couple of years is really the push to expand those mobile crisis response teams, to have more staff available to go out into the community if somebody is in need of that higher level, higher level need or that immediate intervention. So this slide really just kind of shows for DuPage County Health Department, the calls that we have responded to. So the crisis calls on the left are our county hotline numbers. So you can see we have a pretty high number of crisis callers. We anticipate that number to go down. And then that middle column, which is the National Suicide Prevention Lifeline calls, which is now 988, to go up. So really kind of now having that one point on that, one point of contact to be able to reach us, to then be able to say, gosh, do we need to send somebody out into the community? Does somebody need help in real time? And so, and then that mobile crisis response numbers to go up as well. So the numbers are pretty small on that screen, but just this in 2021, we had over 2,000 mobile crisis response calls in DuPage County. So that is both adults and youth. So all together, it's really kind of building that system and making sure if somebody's calling to access, then they have somebody that can come out and reach them in real time. Just to note for our mobile crisis response teams as well, it is a mental health professional, and it's also an engagement specialist. So somebody that has life experience in this, and they can help really kind of support and understand a little bit and provide a little bit different of perspective. So kind of with that combination, really hoping to support people in their time of need and to be able to get them the resources that they need. And then the last is really providing people somewhere to go. So, if they've called 988, now they've had a mobile crisis response, what next? Typically in the past, what's next is a potential hospital stay, kind of that higher level of care. So making sure that communities have somewhere to go available to them. So there's, crisis residential units or crisis stabilization centers. DuPage County Health Department does have one, but there are also 11 in the state. So that crisis residential is really somewhere to go that is a lower level of care, not needing hospitalization, not needing an inpatient stay. It's voluntary, it's unlocked, but it's really for adults that are dealing with their mental health and substance use concerns, needing an extra bit of support before they can go back home. So the goal is to really stabilize and link to ongoing services while providing them a little bit of respite and focus on their needs for, usually about 5 to 7 days, and then leaving with those services in place. The central receiving center, if you can go back one slide, sorry about that. The central receiving center, on the other hand, is kind of that centralized point of contact. So it's not an overnight stay. It's really kind of that, I'm having an issue right now, I need some support. And so it's somewhere to go to get a full evaluation, to get that crisis intervention and risk assessment. And so the goal is to have one in DuPage County, looking at national models and seeing where they are and how they're functioning in other parts of the country. Central receiving centers have not, there's not any that exist currently in Illinois, but we're hoping that we're kind of building out that system to be able to finish out the system. So this is really kind of the overall ideal behavioral health crisis system. So if you look at from the left, they're in crisis, they need something. You know, that first step really should be 988 so that they can call and get that immediate support, or they can call for a loved one to help get those resources in place. The number below that is our crisis county hotline. So that's another available resource as well. But as you kind of look, then it's mobile crisis response teams if needed, that somewhere to go, crisis respite, central receiving center, and then that post-crisis wraparound. So what are we doing post-crisis? Really making sure that we're linking to community providers, that people have the resources that they have available. You know, so overall, again, that final goal is every person receiving the right service in the right place every time. So I just wanted to kind of provide some local resources, you know, making sure that everybody is aware of what is available locally. So crisis services for the DuPage County Health Department is located in Wheaton. It's 24/7. There are always staff on site available for walk-ins, for appointments, anything that is needed. And that is our local hotline, that's 627-1700. And then the 988 Suicide and Crisis Lifeline. That website also provides some really nice resources, you know, printable materials, all of those types of things to be able to share and educate with, you know, with your networks. And then this is really a list of just on, you know, more resources that are available, not just locally, but are available across the state. So the crisis text line, especially for adolescents that really don't like to pick up the phone and call, the crisis text line is very popular for that. And then we have the Trevor Project, which is available for LGBTQ youth. There's a call for calm text line. So again, another way to reach out to say, I'm really in need of support and need somebody to reach back to me. And then we have the helpline specific for substance use. Warm line is for really that lower level, you know, so it's not meeting that crisis level, but just some ongoing support. So, you know, it providing people a wide variety of educational materials and outreach materials so they don't have to wait until they're at that crisis level of need. And then lastly, for those that may be interested in learning more about mental health and really how to provide some intervention, how to provide some education, mental health first aid training is a really great opportunity to learn skills on how to respond to signs of mental illness and substance use. And then there's kind of that applied suicide skills intervention training is another step beyond that. So it's another kind of advanced model that teaches participants how to assist those at risk for suicidal thinking, behavior, and attempts. And that concludes my presentation. Thank you so much.
Thank you, Lori. That was excellent presentation. You guys doing a lot of work there in DuPage County, which is obviously we travel through DuPage County, so we appreciate your work. And a lot of good information about the new 988 number, which the one question that I did have is with the new 988 number, will the previous 1-800 number still be available
Yes, they are not sunsetting the previous number. We know there's a lot of advertisements and information with the old number out there. So yes, both numbers are active and will remain active.
Okay, because we're in the process of updating our signage to the new 988 number, but we still have the old 1-800 number out there.
Yeah, that wouldn't be a problem.
Yeah, and then the other question, we had a question come in. Are service animals a sign of mental health issues, and should those people not be allowed near railroads?
No, I wouldn't think there's any connection with service animals. And so I wouldn't think that there would be any additional risk with that.
Okay, and then another question with the new 988 number. I know with the 1-800 number, the previous number, they weren't able to track usage within areas because it was based on area code and not cell, it didn't ping cell towers or anything. With the new 988 number, did that tracking improve where they can identify the areas where callers are calling from?
So it has. I think they're kind of working on that technology and pushing it forward. We are starting to see enhanced reports about calls coming in, from DuPage County specifically. So I think it's definitely in the process because it is a known. We really need to know where these calls are coming from.
Okay, all right, and then we got another question for Jeff. Yeah, I think so. So they asked if your research was available, which I think you had the copy of the report. And then the individual is with Cook County and they plan to apply for the 2022 CRISI grant with treatment in mind on hotspots, and your report, could shed some light on and insight on some of those. So
Yeah, I did have the links in the presentation. I also answered a question asking for them. Certainly the TRB website is a good resource, not just my recent report, but some additional ones could, other reports on that website could be very helpful. As Hilary mentioned, that it's a good repository of research for a lot of different topics, with the TCRP program specifically focused on transit things. So it's bus and some rail projects as well. Certainly the toolkit that FRA has created and that Scott is working on, it would be another tool that they could utilize when they're looking at potential solutions.
okay, great. And then we have a question for Scott. Scott, through your work with the International Community of Railroads, are there any trespassing and suicide solutions or programs being implemented elsewhere that you believe would benefit the U.S.?
Yeah, I mean, I think a lot of them are kind of variations on themes that are happening here, different types of surveillance technologies, which can identify someone might be in a location they're not supposed to, or loitering for a period of time they're not supposed to. So there's a lot of those types of things. I feel like the place that it seems like, at least in the past couple of years, the international community is moving more into that than we have made less movement towards, that is in engaging with ridership and trying to have riders say, hey, this is an individual who seems a little stressed, and just either approach them or they identify that person and then talk to somebody who's at the station to go approach them. So kind of enlisting people to identify other people that might be in need. And that seems to be something that is more common, at least with the European colleagues that we have, than here in the US right now. So that's one area.
Thanks, Scott. And then another question, are other countries also as good as your presentation? Which I'm not sure what that's referring to.
Hilary, can I circle back on something that was asked
Sure.
earlier? We have one of our really good family friends who trains dogs for detection of low sugar levels for type 1 diabetics. And so not all service animals are necessarily mental health related. There's, of course, vision impaired and some other health issues.
No, that's a good point. And then you know, there's a lot of service animals for, you know, social anxiety and that sort as well. So that's good. That's a good point.
And then to, you know, what Scott mentioned, we did hear in our research and talking to some of the agencies, kind of that see something, say something apps that they're trying to develop. So I think it's maybe going to start coming online a little bit more. What Scott's saying is being applied at in the international locations. So there could be some applications or something that the agencies in the U.S. start having available for users to identify potential concerns in people who might need assistance.
Yeah, and we have the app, we have the, you know, see something, say something app, and there is a reporting component on there for, you know, trespassers, that sort of thing. So I do see that. And I think what Scott was saying is also important with involving the public a little bit more. I mean, there are riders, there are eyes and ears, and if they see something a little bit, you know, somebody that may be in distress or troubled, they have, you know, provide them with the opportunity or the tools to contact us to let them know. You know, I mean, we're so entranced in looking at our phones, you know, it's just, it takes a couple minutes just to get your head up out of your phone and just, you know, observe people, say hi, you know, that sort of thing. So I know that one of the carriers in the UK has Network Rail has a really good program for that, and that's what we're looking to do, something similar to that. So that's how we.
They had I think it was a Small Talk Saves Lives campaign that was from a couple years ago about just kind of, if you know, engaging innocuously with someone who seems like they might benefit from a short conversation. So yeah,
exactly. Yep. And you know, I think unfortunately here in the U.S., you know, we're there's a lot of, and Laura, you may be able to address this. There's a lot of concern a lot of times, even just with other railroads that I've talked to. There's a concern if they, you know, question somebody about suicide, or, you know, if it's listed in the, you know, that it was, you know, somebody died by suicide, that you may be planting, you know, the seed or the idea in somebody else's head that may be troubled or in distress.
Yeah, I would definitely say that's a common myth, and really hoping that all of these prevention and educational, you know, strategies to really eliminate that, to really, you know, anytime that you're feeling like somebody is struggling, if you have that kind of gut feeling that something's going on and somebody's struggling, they probably are. So, you know, reach out and see what you can do to help.
Yeah, and we always tell our conductors and engineers, you know, even if, you know, you see somebody that may be in distress or troubled, you know, just even go up to talk to them and say, hey, how's your day going? You know, or do you know what time it is? Anything to break their, you know, thought process, and just maybe engage in a short conversation, you know. But then we just did get another question. What impact did the pandemic itself have on suicides in 20 and 21 versus previous years?
I don't have that information, but I will say that I don't think we're even seeing the full scale of what the pandemic did with mental health and substance use and suicide. So I think that data will continue to come out. And I think that's why it's so important now to make sure that we're educating on this any chance we get.
Yeah, I agree with you wholeheartedly. I think that the data is not there yet, but I think we'll, you know, be somewhat, I mean, surprised if it hasn't increased. Okay, with that, we're 6 minutes early, so I'm going to turn it back over to Dr. Wilson. And again, thank you, Lanny, for this panel. It's, you know, obviously it's very near and dear to my heart. I've been working with this a long time, and, you know, continuing to try to, you know, reduce some of our you know, trespasser incidents. You know, it's, especially when 47% of ours are due to, you know, suspected suicides or suicide. So thank you. And thanks everybody for your information, your knowledge you shared. You know, it's very important. It's extremely important. We continue to do this research and work together to prevent and eliminate these incidents. So thank you.
Good job, Hilary. You know, your connections that you've made around the country have just been so impressive. The message that you carry from the work that you're doing here. So proud to be your partner in this. I have a couple of questions. We've got just a few more minutes. I wanted to ask, I really liked Lori's behavioral health crisis system. Now, I happen to be a little bit biased because I'm vice president of the Board of Health here in DuPage County. So I think we do great work here. But is this behavioral health crisis system, is this something that we've invented here, or is it something that's catching on around the country?
I think it is catching on around the country and across the state. So the Illinois Department of Human Services Division of Mental Health has offered lots of grants to move these initiatives forward. So for 988, it is a fully statewide, nationwide network, and Illinois is working to make sure there's always that local response. Our mobile crisis response teams are also statewide. So every county, every area has mobile crisis response teams available. The number of those teams and the capacity of those teams might ebb and flow based on county or based on area, but everybody's working in that same direction. That somewhere to go, I think, is newer, and people are taking a look at that initiative right now. That's something to explore probably across the state, and I think we're in DuPage County a little ahead of the curve with that. Great
answer, Lori. And I've been thinking about drones for several years now, as some people know. This is a question maybe for Scott or Jeff. The question was asked, I think by Brian. He said that his child had a drone that could talk to him. And I'm thinking about maybe active signage. So I think in your message, Jeff, you talked about someone going up and hugging the sign. He read the sign, and maybe I've got some maybe there's a save that day, but maybe if drones could go and give those messages, there's help for you, is anybody looking at that kind of research, and is there hope there possibly?
I think it could, I think it was demonstrated earlier that it could certainly is possible. So I don't know why that you couldn't tailor those messages to accommodate the situation. I know, just from a trespassing prevention, I think BNSF Railway in the Los Angeles area has some sort of flashing light and speaker system on their drones to try to run people off. So, I think if Utah, I'm speculating on their behalf, of course, but if they have those hope poles and they see someone near the hope pole, then it would maybe make sense to have more of a kinder message instead of one that's just trying to run the person off. So it seems like it's certainly doable, and I think the agencies will start maybe differentiating between the different messages that they need to convey from the drone.
Just food for thought.
Capability,
Yeah, thanks for that answer. Scott, you're nodding your head. Any thoughts to follow up there?
I think I'd largely just echo what Jeff said. I think the idea is if somebody is in that frame of mind in that moment, anything that you can do to break them out of that frame of mind and remind them that there's hope out there and there's other people. And I think like that hope pole, Jeff, the idea that the light comes on maybe is a moment in time when that breaks you out of it. And whether it's a person reaching out or some sort of technology that feels like it has a more personal touch with a voice or something, I think any opportunity to break that thought process is probably has the potential to work.
Thanks. Speaking of hope, we addressed the pandemic a little bit, and we really still haven't seen all of the data coming out of the last few years. Is there hope, projecting forward as we move out of the pandemic? Maybe some of the problems of the pandemic, which caused maybe an increase in people taking their own lives, increase in maybe substance use disorders. Is there hope that maybe we might see some decrease in numbers as we go past the pandemic? Anybody have an answer for that?
I would add, I think there is. I always say the silver lining of COVID, because there has to be one, right? is that the stigma has been reduced. I think people have realized that there, mental health and substance use issues are just the same as any other medical issue or anything else that you might be struggling with. And so I really think that COVID helps bring that to light. And so hopefully people will be outreaching, people will be getting the help that they need earlier on so that we can see these numbers reduce.
Good job. Faith, hope, and love. The greatest of these is love. Keep up the good work, guys. Hilary, thank you so much for you and your team. It was wonderful. I'm applauding for the whole audience out there.